You know, when you're dealing with one of the world's most common chronic diseases, the idea of a natural solution sounds amazing, right? But what if that same natural remedy could be both a huge help and a hidden danger? Okay, let's dive into this because it's pretty complex.
First, to get a sense of just how big this is, look at this number, 415 million. That was the estimated number of adults around the world living with diabetes just a few years ago, and that number is only expected to climb. So this isn't some small issue. It's a massive global health challenge.
So, what are we really talking about here? Well, for the most part, we're talking about type 2 diabetes. The easiest way to think about it is like this. Insulin is the key that unlocks your body's cells to let sugar in for energy. With type 2, the locks on your cells get kind of rusty. The key doesn't work so well anymore. That's what doctors call insulin resistance, and it means sugar starts to build up in your blood, which can be really dangerous.
Now, to handle this, people have their conventional treatments: diet, exercise, prescription drugs. But when you're facing a lifelong condition, it's really no surprise that so many people, up to 72% in fact, also start looking into complementary therapies. Things like herbal remedies, just hoping for an extra bit of help.
And look, we're not just talking about old folktales here. Modern science is actually taking a serious look at these ancient remedies. They're putting them through actual human clinical trials to see if there's any real hard evidence to back up their use.
And you know what? Some of the findings are pretty compelling. Take a look at this table. It sums up data from a big review in the Sultan Qaboos University Medical Journal. You've got blackseed, for instance. Studies showed it actually improved glycemic control and lipid profiles. That's basically your blood sugar and cholesterol levels. And then there's fenugreek, which was found to seriously reduce fasting blood sugar. These are real, measurable effects.
In fact, the evidence for some of these herbs is getting pretty strong. The same review made this really powerful statement about blackseed, pointing out its consistent positive effects across multiple studies. That's a huge deal in research. It shows a clear, repeatable benefit. So it all sounds incredibly promising.
Which probably has you thinking, awesome, problem solved. But, well, it's not quite that simple. There's a really important complication we have to talk about.
And this is where we get to the real heart of the issue, what we're calling the double-edged sword. It's what happens when these natural remedies come face-to-face with the conventional pharmaceutical drugs that someone might already be taking.
This is something called a herb-drug interaction. Basically, it's when something in an herb changes how a drug is supposed to work in your body. It might make the drug weaker or way too strong, or cause side effects that you'd never get from either one on its own. A lot of the time, this action happens in your liver, where the compounds from an herb can mess with the very enzymes that are supposed to be processing your medication.
But here's the thing that's so fascinating. The word interaction doesn't automatically mean something bad. It really is a double-edged sword. An interaction can be a major risk, for sure. But, and this might surprise you, it can also present a potential benefit.
Let's move away from theory and look at some concrete examples from the scientific literature. This is where it all becomes very, very real.
So, an interaction can basically go one of two ways. On the good side, you can have what's called a synergistic effect. That's just a fancy way of saying the herb and the drug work together to create a result that's better than what either could do alone. But on the scary side, that same power can amplify a drug's effect way too much, and that can cause an adverse reaction like hypoglycemia, where your blood sugar drops to dangerously low levels. Okay, check this out. This study is a perfect example of the benefit side. Researchers took diabetic rats and gave them a combination of ginger extract and a smaller than normal dose of the drug glibenclamide. And the result? The combo worked just as well as a full dose of the drug. I mean, that hints at a really cool possibility. Maybe we could use herbs to allow for lower and maybe safer doses of pharmaceuticals. But here's the other edge of that sword. And this isn't a lab study, this is a real-world clinical case. A patient with type 2 diabetes was on 2 standard drugs. Then, they decided to also start taking prickly pear cactus, which is another natural thing known to lower blood sugar. While the combined effect was just too much, and the patient ended up having a serious hypoglycemic reaction. It's a pretty stark reminder that even with the best intentions, these combinations can be dangerous.
So, knowing all this, the good and the bad, how is anyone supposed to navigate this world of complementary therapies safely? Well, it really all comes down to having a smart, proactive approach.
Okay, so what does this all mean for you? Let's boil it down to a 4-step strategy. First, and this is the big one, transparency. Tell your doctor and pharmacist everything you're taking or even thinking about taking. They can't help you avoid a problem they don't know exists. Second, Be your own health detective. If you add something new, monitor your blood sugar like a hawk to see how your body is actually responding. Third, you've got to challenge that natural means safe idea. As we've seen, natural things can have incredibly powerful effects. And finally, number 4, stay alert. Unlike a prescription pill, the potency of an herbal product can be different from bottle to bottle, so their effects aren't always predictable.
And that really brings us to the final question. In modern medicine, are these herbs a potential partner, something that could lead to more personalized and effective treatments? Or are they just a problem, adding a dangerous and unpredictable layer of complexity? As the science is starting to show, the answer isn't simple. It's probably a little bit of both.